Hi class, this is my informative speech. I chose to do it on respiratory therapy. My audience today will be a group of high school aged children, or young adults I should say, who are attending a career day. So I will begin. Good morning, future of America. Are you looking for a career where you can make a difference in the well-being of other people? A job where you can save lives? A workplace with many opportunities for advancement, with opportunities that pay well, and you don't have to go to school forever? Well, today I'm here to tell you about the exciting profession of respiratory therapy. Hello, I am Sean Klaus, and I'm a recent graduate of a respiratory therapy program. I have about 3 years of clinical experience, and I cannot inform you of everything there is to know about respiratory therapy in this short presentation, but I will be telling you a little about what an RT is, their many roles, some of the different career options you can choose, and finally the academic requirements and the salary. So let's begin with, what is a respiratory therapist? According to explorehealthcareers.org, respiratory therapists apply scientific principles to prevent, identify, and treat acute and chronic dysfunction of the cardiopulmonary system. Their knowledge of scientific principles underlying cardiopulmonary physiology and pathology, as well as biomedical engineering and technology, enables them to effectively assess, educate, and treat patients with cardiopulmonary disorders. Okay, that's a lot to take in, right? Well, let me try to break it down for you a little bit better than that. That is precisely what we do, but how about this? RTs are heart and lung specialists. We donate 2 to 4 years of schooling to become masters of the cardiopulmonary system. Cardio meaning the heart and the circulatory system, pulmonary being your lungs. Wherever there is a breathing issue, RTs will be there. RTs work closely with physicians on any form of dysfunction within the cardiopulmonary system, from the emergency room with the critically ill and injured in the ICU to routine breathing treatments and checkups in the doctor's office. RTs must possess critical thinking skills and be able to make life and death split decisions relying on the scientific principles they study. RTs are passionate and compassionate. With all the life-saving and technology aside, we are caregivers in the end. We work closely with our patients and their family members, we get to know them, and we ensure that they are educated and comfortable with their conditions and the procedures they are going through. RTs are very diverse in that they work with everyone from premature infants to the elderly, from the critically ill to the healthy, which brings me to my next point, which is the different roles that RTs can take on. The RT provides hands-on care in such wide range of medical conditions that, again, I cannot cover all of it in this short presentation. But to give you an idea, I will tell you about some of them. You will find us in the hospital giving breathing treatments to people with asthma, COPD, emphysema, and other respiratory disorders. You really get to know your patients on the floors in this role. In the ICU, managing ventilators, which some people call life support, that keeps the critically ill alive. Sometimes this can be a very tough role to take, but it's also very rewarding when you can wean a critically ill patient off of a breathing machine to be spontaneously breathing on their own again. You will find us in the emergency room, delivering life-saving treatments such as CPR, chest compressions, with a laryngoscope, intubating patients, that's where we stick the breathing tube down the closed airway to open up your airway so you can breathe again. Very rewarding job also, very fast-paced. You'll also find us in newborn and pediatric units, helping kids from premature babies with no lung function to children with cystic fibrosis. Anytime there is a premature delivery, you will find an RT there catching the baby, making their lungs work. You'll find us in an operating room, working with surgeons and anesthesiologists to monitor breathing during surgeries. I've been in on many open heart surgeries, brain surgeries. Truly amazing to keep somebody breathing while the surgeon stops their heart, performs his surgery, fires the heart back up, we get him breathing again. Absolutely amazing. You'll also find us in home health settings, providing regular checkups, making sure people have what they need to stay out of the hospital. This is a neat role as an RT because you really get close to your patients. You go to their homes, you talk with them. Something that I really enjoy also. Just not quite as fast-paced as, say, the ER. We are also in sleep labs, diagnosing and treating sleep disorders such as sleep apnea. RTs are found in nursing facilities and pulmonary rehab programs, helping the elderly breathe easier and to get a better quality of life out of their last years. You can also simply just work in a doctor's office, conducting pulmonary function tests and patient education. There's asthma education programs where you can help kids and adults with their condition, teach them how to take their medications properly. Nowadays, there's a lot of smoking cessation programs and facilities around the country that employ RTs. And finally, my favorite, you can work in the air and ambulance transport programs, rushing to rescue people in need of immediate medical attention. This was the reason I became an RT. I love saving lives. I love adrenaline. I love flying. It truly is the upper echelon of RTs. Obviously, you don't come straight out of school into this, but it's something you can shoot for as an RT. As you can see, with the many roles you can play as an RT, there are also many career options you can consider. As an RT in the hospital setting, you will have no problem if you wish to climb the ladder and rising up in the ranks. You can go from RT on the department floors to RT supervisor to department manager and even up to the highest levels of hospital administration. RTs who specialize in home care can branch out and establish their own home care companies. It's the American dream, right? RT can lead you into entrepreneurship if you desire. Some RTs venture into the corporate world also, in positions with equipment manufacturers, designing and marketing new respiratory equipment. Then there is always the need for teachers and professors in our career to teach all of you new upcoming RTs. Finally, you can get involved in scientific research in the respiratory therapy department. You can go on and get your PhD, and you can also become a pulmonologist or an anesthesiologist. Which brings me to my final bit of information, which is the academic requirements and the salary of a respiratory therapist. One of the greatest things about becoming an RT is that you can have a degree in 2 to 4 years. 2 for an associate's and 4 for a bachelor's. But let me tell you, this will be the most intense 2 to 4 years of learning you have ever encountered. Because as I've mentioned to you, you must be a master of the cardiopulmonary system. If there is ever a code in a hospital, could have a room full of nurses and doctors, and a code blue happens, which is the patient is not spontaneously breathing or their heart is not beating, you can guarantee that every nurse and every doctor in that room will scream for respiratory, and we come running. You'll spend countless unpaid hours in the hospital earning your clinical and intern hours. You must be devoted and determined to finish these grueling programs. But when you do, you will start earning an average salary of about $60,000 a year on the national average. But I assure you that most RTs make much more than that. For instance, I know a flight RT right now who is making well over $100,000 a year, and he only went to school for 2 years. Okay, so we learned a little about RTs today and what they do, the roles they play, and the career options, schooling, and salary. So if you found yourself interested in helping people, saving lives, career advancement, 2 to 4 years of college, and excellent pay, I would encourage you to research more on the profession of respiratory therapy. Thank you for your time, and good luck in choosing your career that's right for you.